Your veterinarian calls and says, your dog is anemic. The word sounds scary, but here's the important thing. Anemia isn't actually the diagnosis. It's a clue that veterinarians use to figure out what's happening inside the body. In the next few minutes, I'll show you exactly how veterinarians start thinking through the possible causes. Before we talk about the cause, let's quickly define anemia. Red blood cells carry oxygen throughout the body. When there aren't enough healthy red blood cells, or they don't contain enough hemoglobin, the body's tissues receive less oxygen. That's why pets with anemia often seem tired or weak. One thing that surprises many pet owners is that not every anemic pet looks critically ill. A pet with mild anemia may just seem a little quieter than usual. But if anemia develops rapidly, the body doesn't have time to adjust, and pets can become weak, collapse, or develop very pale gums. Now comes the question veterinarians really care about. We already know the pet is anemic, but why? Surprisingly, almost every cause of anemia fits into just 3 major categories. The first possibility is actually the simplest. The body is losing blood. Sometimes that's obvious, like after an injury. But here's the part that surprises many owners. Some pets can lose blood internally without you seeing any blood at all. Here's something many pet owners don't realize. Sometimes the body destroys its own red blood cells. That's called hemolysis, and it can happen with immune-mediated diseases, certain toxins, some infections, and occasionally even medications. The third possibility is one many people don't expect. The body simply isn't making enough new red blood cells. Chronic kidney disease is a classic example because the kidneys produce a hormone that tells the bone marrow to make red blood cells. This is one of my favorite parts of the workup because it gives us a huge clue. One simple measurement, the reticulocyte count, helps us determine whether the bone marrow is responding appropriately. Think of reticulocytes like baby red blood cells. If lots of reticulocytes are present, the body is trying to replace the lost blood. If they're absent, we start thinking about diseases that prevent production. Once we've narrowed the possibilities, we stop guessing. Every additional test is chosen to answer a specific question. Is there hidden bleeding? Is the immune system destroying red blood cells? Is the bone marrow responding? Fortunately, many cases of anemia develop gradually, but some are true emergencies. If you remember just one thing from this video, let it be this. Anemia isn't the disease, it's the clue. The real job is finding out why it's happening. If your pet has recently been diagnosed with anemia, I hope this helped you understand how veterinarians think through the possible causes. If you found this video helpful, consider subscribing. I post new videos each week explaining blood work, common diseases, and how veterinarians approach these cases.